All right. So today will be somewhat of a mock kind of session, but still hoping still this will be informative for people who are in a later life stage or you are giving a care for another person as a caregiver. So, this speaker series is to help healthy aging and provide some healthy tips for optimal aging. We would be having another session in September. I see Dedrienne joined us, and she'll be talking about more about caregiving tips. And Dr. Allison Chi would also be talking about the healthy technology and aging. And last but not least, Dr. Chelsea Holland will talk about physical activity and aging. So we would like to provide some healthy tips for optimal aging and also receive some questions that it has been lingering to you to be in better health. So do you hear me okay? Awesome. And do you see my screen okay? Awesome. So today we will talk about why sleep is important and common sleep problems and end with some tips for better sleep. We sleep every day. I don't think of anyone who don't sleep each night or even in the early morning or day. And approximately we spend 1/3 of our life sleeping. Other times we eat, we work, we exercise, we walk, we do some amazing things. And sleep is important because that's how we restore our energy and that's how we are healthy during the day to work, live, and love other people. How was your last night's sleep? Can you let me know? Was it good? Bad? How long did it take to fall asleep for you? My son last night, he's an 80-year-old, and he was saying that, Mom, it takes long time for me to sleep, so you need to cuddle me for for an hour or so. But yeah, but if he's next to me, it's like I'm having a bad night's sleep. I don't like, yeah. So many people have different patterns of sleep too. So yeah, so we will be talking about that. And how long did you sleep? 6 hours or 7 hours? I wanted to test our Mentimeter if that works, just for this one question, just because I would like to know how people sleep. So if you can log in to this Menti, just click on this enter this number for menti.com or use this QR code to connect to the this page. So I wanted to ask, how much do you sleep last night? And using this QR code, maybe you can just use your camera to log in to this menti.com or use this code by going to menti.com. I see 7 hours and 10 minutes, and 9 hours and 10 minutes, and 7 hours, 6 or 7 hours, about 8 hours. Ooh, yeah, 6 or 7. Yeah. The National Sleep Foundation recommends adults sleep around 7 to 9 hours, but everybody's body is different. So if you're sleeping and if you feel great after 6 hours of sleep last night, that is great too. But just to let you know that the amount of sleep isn't always the right answer for everyone's body. So it might be different. So I just knew that this mentee worked great for you. So I'm very glad that it worked. So maybe next time we'll use it for further questions too. Any wake ups last night? I did to go to bathroom, or I feel like I think there was a rain last night or something, or now Iowa there's some rains last night, like last few days or thunderstorms, so you might got up during the night. In the morning, do you feel rested and restored and refreshed? Kind of. Maybe some people not. Yeah. So, we sleep to engage more during the day. We sleep to be active, more in the day. But people may have trouble falling asleep, staying asleep, waking up too early, or trouble going back to sleep and feeling tired. So that's called insomnia symptoms. And you can test your insomnia symptoms by using this link, but I will not go into further because this is just an overview of the sleep problems and sleep tips. And I would like you to talk with your sleep physician or a primary care physician after this if you think you need some medical help. In Iowa, of course, short sleep is very common. Um, they may have different reasons, but approximately 33% of the people in Iowa um, sleep shorter than the recommended 7 to 9 hours of sleep. So if you're living in Iowa, maybe you're one of these people. And I just wanted to mention that many of us are caregivers, and caregivers often find themselves very um, exhausted at the end of the day, and but many people not able to sleep. Some of the studies say that 70% of the caregivers for people with dementia report sleep problems, and 60% report sleeping less than 7 hours. And 10 to 20% of the caregivers use alcohol to go to sleep or use sleep medications. Many caregivers report high levels of burden, stress, and depression, and these might cause problems, and these might lead to sleep disturbances because of the person that you're taking care of may have some sleep disturbance too, and that can lead to sleep disturbance for you as a caregiver. So I would like to acknowledge that if you are giving care for another person, that is really need to be acknowledged. I know you are doing really important job for your family or your loved ones, or and we would like to really help you out with that. And people with dementia often have syndrome called sundowning. It is very common that people are getting agitated at the end of the day or during the night, has trouble falling asleep or staying in bed. So that can lead to sleep disturbance for the caregivers as well. And that lead to you're not being active. You cannot be active during the daytime. You're feeling very tired or drowsy during the daytime, and that may lead to some um, car crashes or reduced attention, slowed reaction time, impaired judgment due to the fact that you have a bad night's sleep, and that can lead to your function during the daytime. So I cannot re-emphasize more about why sleep is important. Um, we rest and we restore our energy during sleep, and it is important for your psychological or and physiological well-being. And of course, you know that it is helpful for immune function. I teach university students, and then at the finals, we just finished our finals, and many of the students didn't go to sleep, and many of them say they get sick after the finals because they were short on sleep and being tired all the time during the last week of the finals. Hopefully they got sleep after this final too. And research shows that sleep is important to regulate your blood pressure, your blood glucose levels, your cardiovascular health, and cognitive health. So people with shorter or disturbed sleep have increased risk of having hypertension, diabetes, cardiovascular disease, stroke, and Alzheimer's disease. And of course, you will feel grumpy after bad nights of sleep. So, sleep is important for your mood, and lack of sleep or sleep disturbance can be a symptom of depression, but also worsens your depressive symptoms as well. And it is related to anxiety, more irritabilities too, if you're not having good night's sleep. Of course, sleep is important for your brain health, everyday cognitive performances. You focus more, you process well information faster, you have better problem-solving skills if you have a good quality sleep. And short sleep or disturbed sleep can be associated with development of Alzheimer's disease and related dementia and brain network connectivities as well. During the night, we fall asleep and our sleep stages go from very awake to stage 1 to 4 sleep. And this pattern goes 3 to 4 times a night that we feel more rested. So, having a good night, like continuous sleep, will help us to go through these cycles of stage 1 to 4 sleep to REM sleep so that we feel more rested throughout the night. If you wake during the night, you will have just like 2 cycles of 1, 2, 3, 4 stages that may not be restorative at all. So you might feel very bad after waking up in like this second cycle or first cycle. So deep sleep is important for gain memory, gain energy, and feeling more restorative. But people with insomnia, people with sleep disordered breathing, sleep apnea, restless syndromes, or having neurological diseases or cardiovascular disease can lead to sleep problems. So people may have take longer time to fall asleep, wake up too many times during the night, and then may not able to get back to sleep and wake up and very feeling tired and very sleepy during the daytime. So, we may not have good sleep hygiene or environment, or you may have sleep disorders or psychological problems, medical problems, medications. Like as we age, naturally our sleep getting disturbed. And some people have non-standard schedules, like shift workers or stress, may lead to some of the sleep problems that you're having. Circadian rhythm is how we regulate our sleep and wake cycles. One way is that if you got bad sleep, you may feel tired the next day. Another way is our circadian alerting signal helps you out with sleep. So our biological clock inside of you receive the light and lights, bright lights to the eyes, and then increase our activity during the day. And if the sun goes down and we feel sleepy because there are like melatonin levels increase from your pineal gland. So, as we age, or if I'm going through the menopause, our sleep architecture changes over time. You see, the young adults have more sleep, 3 to 4 stages of sleep, but people with older age may experience switches over these sleep stages throughout the night more. So the sleep may not be as deep as young people for people who are older in later life. And this meta-analysis show that people as we get older, there is more wake after sleep onset, meaning that you wake up more often as we age. It starts from like age of 40. So 35 to 40. So like I'm in that age group and I see myself and my sleep may get worse thereafter too. So we have these patterns. People have different circadian rhythm patterns, but like our body temperature changes, our cognitive function changes throughout the day. We are feeling very sharp during the morning, but that kind of warms down at the evening time. And then that is our like how our circadian rhythm regulates our body. It regulates our blood pressure, body temperature, melatonin levels, bowel movements. So our body regulates ourselves based on our circadian rhythms. And these can be changed by like our activities, food intake, body temperature, or social interactions. And these like central circadian rhythm can be changed by these external factors, and these factors can change our physiology and behavior throughout the day because we are living in Earth and we synchronize ourselves to the cycles in the environment, how the Earth is rotating, and we have that biological time of day, month, years, and seasonal changes. So our body adjusts to this big system. And circadian characteristics are found to be related to our health as well. So we have these sleep problems, and for people who are taking care of others, may change their routines for their loved ones or their for someone else. May not have fresh air, exercise, or relaxation. That self-care may lack due to caring for others. So that can lead to changes in your sleep schedule. And sleeping environment may have changed due to when you're taking care of others. And of course, taking care of someone else may invoke worriness. You may feel may have trouble going to sleep or wake up during the night because your mind is busy thinking about your concerns. Some caregivers talk about wanting to a remote control of shutting off or like change channel. So it is hard to take care of other people. And in many cases, if you're taking care of someone, it is hard to find someone else to take care of that person during the nighttime. Um, and always needs for to take care of persons, and that's hard for emotionally and physically. So that's why people may feel very unrested during the day and hard to fall asleep and hard to stay asleep during the night time. Some people are just naturally the night owls, and some people are more naturally the morning like. Um, can you let me know, like, how many of you are morning larks? Okay, very good. How many of you are night owls? So there are some still research going on what is better over the other, but we're still trying to find out what is better or worse. But there is no definite answer. Even the researchers didn't find that one as well. And then environment. Some of the sleeping environment are still too bright or too cold or too hot. Now it's approaching summer, so you may feel hot in the nighttime. And maybe your bed partner feels cold in the bedroom or hot in the bedroom that may feel different than you do. So I hope you find some nice bed partner that matches your temperature too. And of course, I talked about the caregivers who worry during the night, but also other people, many other people worry about many things. So that makes us hard to fall asleep in different reasons. And some people have some sleep disorders, restless leg syndromes, or sleeping sleep eating disorders or sleep disordered breathing. So even though you don't know whether your sleep has been disturbed due to your sleep conditions, you are asleep and may be bothered due to this type of disorders too. So, do you have any questions why sleep is important for you and also the types of different sleep problems? No? All right. So let's get moving. So I see some chats. Oh, so Sam said like your cat. Actually, one of my study, one participant mentioned like they adopted the new cat on that night. She didn't like have really good sleep because cat was crying and moving. So both cat and the person didn't really had that a good sleep that night, the first night. I assume the cat was very worried too. So the cat had a very disturbed sleep during the night and as well as the owner. So caregiving is another for your pet may be disturbing your sleep too. So let's talk a little bit about general ideas of sleep. But before I would recommend to know your sleep better. Track your sleep for about a week to understand your personal behaviors. Look for wake up time, sleep time, how frequent you wake up, or maybe creating a sleep schedule for consistency is a good idea. So you can use sleep diary, or nowadays you can use like Fitbit, Apple Watches, even your phone tracks down your sleep. So you can have the general idea of your sleep. So like if you write down in a piece of paper when you fall asleep, how long did it take to fall asleep, and when you wake up in the morning. So it is a good idea to reflect back each morning about your last night's of sleep. And also logging down like whether you feel rested or and also whether you drank or took any sleep aids to help your sleep too. So just to know your patterns, so that in the future you can create your own sleep schedule and know what worked best and what did not. Try to go to bed only when you're tired. Many of insomnia patients trying to have like 7 to 9 hours of sleep so that they go to bed in certain time and trying to wake up and in a certain time. So you feel guilty if you're not going to bed on 9 p.m. and not waking up at 7 a.m. in the morning. So rather, if you're not feeling sleepy, get yourself moving instead of just lingering in your bed, watching your cell phone, or just thinking about the day or worries. That doesn't really help. Only go to bed when you feel tired and sleepy. If you're not, get out of bed, read, or maybe do a mild exercise, or maybe do some meditations that may help you out. Making an environment, dark and quiet environment, is like, is helpful because like light is has a drastic effect on your sleep and your circadian rhythm. The morning bright light will help you to be active during the day, but the nighttime light may not help you. Maybe you can buy some blackout curtains to keep your room dark and it can increase your sleep quality. And in your internal body temperature will drop 2 degrees throughout the night. So but it might be nice to have a cool air temperature around 60 to 67 degrees. Warmer temperatures can cause discomfort and restlessness. So make sure that you are in this temperature levels. As I mentioned, our rhythm is regulated by the sunlight in the morning. The bright light you receive through your retina will stimulate your suprachiasmatic nucleus and then regulates our melatonin levels throughout the night and day. And then that diurnal patterns of cortisol and melatonin will help you stay active during the daytime and feel sleepy during the nighttime. And exercise will help you be active during the day, but 3 to 6 hours before bedtime may not be helpful because those adrenaline surge during the evening time may worsen your sleep. Oh, limit your caffeine intake. I cannot function without coffee during the daytime, but afternoon coffee sometimes may not help your sleep. Some research say it's some people would take 9 to 21 hours to clear up the caffeine from your body system. So if you have insomnia, maybe limiting your coffee would be helpful. So no caffeinated drinks during the evening time, like pop soda or some of the like herbal teas that may contain the caffeine will worsen your sleep quality. Eat properly. Eating too much or too little can cause your sleep disturbance, may increase your alertness. Keeping clock face away from you. Some of the oh sorry, I'm not yeah, and limit the device usage. So, limiting electronic device before bedtime is important because those blue light can stimulate your brain, and then that may cause sleep disturbance in the nighttime too. And keep clock face away from you, as I just mentioned before, because those clock can the time provoke your worries, and that doesn't really help your sleep throughout the night. And even if you want to watch your phone for sleep, that will really stimulate your brain and then make hard for you to go back to sleep. And TV as well. So no TV or cell phone in the middle of the night. And take time to unwind before bed. Those relaxation times may help you out for better nights of sleep. Do you guys like do some night routines, like write journals or read books, or like meditate or taking a hot bath? That kind of helps you out, relax your muscles, but also relax your brains for the throughout the night. And meditative breathing can also be helpful too. So these are the techniques for the cognitive behavioral therapy for insomnia. And it doesn't have to be like one methods, but maybe trying out different methods would be helpful. Some of the times, keeping of like a worry or thought paper or diary or journal might be helpful. Some nights I worry about something, and many of the times I cannot solve that problem in my bed while I'm trying to sleep. So thinking about that big worries may not be helpful, but what you can do is maybe write something down on your thought paper that what are your worries are, and think about what can I do now or what can I do later. Um, and then write down something on a piece of paper and trying to see where you are at. Many times it's hard to solve in a one night, right? There are a lot of problems going on with your family, work, life, and climate change, like things like that, that cannot be solved in a night. So maybe it's good for you to write down. And for you as a caregiver, it is hard to maintain those nighttime routines because you need to take care of others. But however, I would recommend you to try to have regular sleep and wake schedule as much as possible. Grab Take care of yourself by doing some exercise every day, get some fresh air if that's possible. Coffee may not help to have maintain your sleep. But again, many of the people who are ill or having disease may take a nap during the day. And I know many caregivers do not nap during that time. Rather, they do other stuffs. But if your loved one or family member is having a nap, try to have a short nap as possible to regain your energy. Don't feel guilty about taking that time for yourself a little bit. Like you can do some light exercise or napping during that time as well. And as much as possible, identify and talk about the worries that you have. Find a ways to share your worries or concerns before bedtime, not at the at the bed. Um, like if you cannot find someone to tell about your worries, like again, writing down a journal would be helpful to just to debrief yourself in the evenings or in the daytime as well. And maybe setting up some relaxing techniques would be helpful. Some people find it reading is very relaxing, listening to music or meditate for a short of time or even pray. Some of those spiritual work can be helpful to have you fall asleep and maintain relax your muscles and thoughts. And some TV shows might helpful be to relax yourself a little bit too. And for older adults, try to set up a safe and restful place to sleep. Make sure that you have smoke alarms each floor in your home. Before going to bed, lock all the windows and doors that leads outside. Other ideas for a safe night's sleeps are keeping telephone with emergency phone numbers by your bed and have a lamp within reach that is easy to turn and put a glass of water next to you so that you don't have to walk to the refrigerator or that makes or like that may increase the fall risk. And then don't smoke, especially in bed, and remove the area rugs that may invoke the like tripping down or falling down. Just wanted to mention that some food may improve your sleep that are rich in melatonin and zinc and magnesium. Um, Bananas, so kiwis are rich for the serotonin and melatonin, so it may be good for your sleep. And some of the fatty fish that are rich for omega-3 and vitamin D, so that may help you fall asleep. And then food that have high magnesium can like create some relaxing conditions for calm down your central nervous systems, relaxing your muscles, lowering your core body temperature, and increase GABA. So the food that the whole grains, nuts, or leafy greens, or whole wheat bread that will help you on increasing your magnesium levels and may help you sleep. It doesn't have like really direct effect of these food improving your sleep, but this will help you for your minerals and electrolytes and help you for maintain and stay asleep, have more better sleep. People with insomnia often have some electrolyte disturbances or underlying the lack in minerals. So it might be nice to check on your electrolyte levels to ensure that you are not lacking anything. And some of the herbal teas like chamomiles can help you go to sleep. Even hot like warm water help you relax and help you sleep better during the nighttime. Sleeping medications, yes, it will help you fall asleep. And there are some options that you can take. Over-the-counter sleeping aids can cause some dangerous overdose reactions, but if you use wisely, that will really help you fall asleep and staying asleep. Sleeping pills require prescription that can be habit forming, but overall goal of any sleep medication is that the patients easily sleep easily throughout the night and wakes up refreshed without relying on medications. So many of the medications are used for short term, and there is no definite answer for one person for a longer period of time. So you have to talk with your sleep physician what's right dose and medication for you. Some of the easy ones are melatonins, and getting older, our melatonin levels may decrease, so melatonins may help, but you have to take the melatonin not right at the bedtime, maybe at least 1 to 2 hours before bedtime to help you fall asleep. And this is like over the counter. And you may see the Benadryl, the diphenhydramine, the Advil PM, Tylenol PM, is the Advil added with the antihistamine or the Tylenol added with the antihistamine. So it's basically these antihistamines help you fall asleep and staying asleep, but it can have some daytime sedation. You may feel drowsy during the daytime, even after you wake up in the next day in the morning. So they're usually not for long-term use, but short-term use, it may work for you in the daily basis. So there are some the antihistamine separately than these PM drugs. So I would recommend if you're just wanting to have that night of sleep aid that use the diphenhydramine instead of using the Tylenol or added stuff so that whether that so that you can know what works best for you than the mixed drugs. Trazodone is used for the depression, but it helps on your sleep good. It is of use, is it recommended for use, short-term use, but many people use long-term. But again, you need to talk with your sleep physician about using the trazodone for a longer period of time because it may cause some anticholinergic effect like dry mouth or constipation, or even some of the people may have like glaucoma, or other types of underlying conditions may be affected by these anticholinergic effect. And then like Ambien or Halcion, and these type of drugs are called benzodiazepines. And these are a great use for the short-term use, but in the long-term use, there could be some side effects, or if you stop it abruptly, that may cause more severe insomnia after all. So trying to use cautiously after speaking to your sleep physicians for these. So these are some examples of the medications, but there are a lot of options for you to use. But over-the-counter medications, I talked about the melatonin or Benadryl, that could be good for short-term use. And if you have some other drugs that has been prescribed from your sleep physicians, maybe the sleep physician will have different recommendations. But again, we want you to not just rely on the sleep medications, but also use some tips that may relax yourself and have a lot of fruits and vegetables and make your environment best for you to have good sleep. Do you guys have any questions for better sleep? Before we go on to my research, it will be my research type, just to show that I work at the university and I do research on sleep. So that's why I talk about sleep today. So my research is looking at circadian rhythm and circadian rhythm activities in aging and how that can influence our cardiovascular health and cognitive health. So that's how I do it, and I um, I measure melatonins throughout the evening, and we found that those melatonin levels are related to our cardiovascular health as well as our cognition too in your brain. So I'm hoping everyone gets good nights of sleep every day, 6 to 8 hours and 7 to 9 hours. And speak with your healthcare provider if you have any sleep problems. Use your sleeping pills for a longer period of time. If you have any depression or anxiety or pain or change in medication, if you snore heavily or stop breathing at intervals, that means that you have you or your loved one or bed partner or someone else may have the sleep disordered breathing um, that requires some tests for sleep disorders. So my takeaway message is for you to know your sleep better by logging or just monitoring with your watches and make good sleep habits for better mental and physical health. And there are some resources out there. There are some nice YouTubes, but National Sleep Foundation or National Sleep Research Society, American Academy of Sleep Medicine, CDC, National Institute of Aging, and UIHC. Sleep clinic, although it is hard to get in the line for meeting with the sleep doc, but it is really nice to meet with your sleep physician and talk about your sleep and plan for your better sleep. That will be really nice for you. Any questions? And I just wanted to thank you for today. And I would like to receive any questions you have, or if you're too shy, then you can just email me for any questions too. And at the end, I'll share the Menti again for some feedback as well. Just before I forget, I wanted to tell you that. Oh, so Adrian shared that she has worked in the night shift for many years that affect the sleep quality as well. Yes, those shift work can affect your sleep, even though you thought your body's biological clock was adjusted to that, but the social environment doesn't really is that scheduled yet. So that may interfere with your biological clock, and that in long term can be affecting your night's sleep too. Yeah, limiting caffeinated beverages and electronic devices may be like really helpful to for better sleep, but it is not easy. Like it is not easy, right? Oh, Chelsea, you shared you keep a little journal by bed to write down thoughts and worries to revisit the next day. Yeah, some of the I see like the worries seem really big in the nighttime, and then in the morning, after the sunlight, it is little different feelings with that same thought. So it might be really nice to keep a journal um, in the evening times or night times or whenever you're available would be really nice too. Any other questions for me or thoughts?
I'll ask a question about seasonality. What are your thoughts about sleep pattern changes kind of with the seasons? Because I'm someone who's really strongly cued by the sun coming up, and in the wintertime, I just want to stay cozy in bed for way too long.
Yeah, yeah. The someone who do research in circadian rhythm, I guess like seasonality is really important. The amount of sun we're getting in the winter time is very lacking, and that may increase our tendency for depression and may have more worries. Right? And then that night level will not stimulate our retina that much. That will reduce the amount of melatonin levels during the winter time. And that could affect our mood and physiology during the winter time as well. So try to get more sunlight as possible, even during winter time, even though the temperature is really, really low. And also in the spring, although we have more sunlight, but their seasonal allergy kicks in. So many people sneeze up in the morning times that affect your sleep in the morning too. So these seasons may affect, and also there's a social jet lag due to the daylight saving time changes, and that affect our sleep schedule a lot. And sleep researchers are really against that, but it is what it is. So we need to buy our social norms to be in this society. So that may affect your sleep schedule too. But try to rest as much as possible if that comes in. And then during the winter time, it might be nice if you can be more active and get more sunlight during that period of time. And even for like light glasses or bright light boxes may help to have that bright light exposure in the early morning that will help you to better sleep during the nighttime too. So there are some options that you can use, but it is not easy if you're living in the earth and you're living in America, that many people are hardworking and want to buy the social norms, right?
Chooza, thanks for talking about the light box. I have one.
Uh-huh.
When I just started to use that last year, and I really did notice a difference with it when I took the time to do it. Yeah,
Exactly, exactly. It's hard to add something in your
yeah,
routine.
yeah, yeah. But
You're
it may,
still busy, yeah, right?
yeah, and it just even 10 minutes in the morning, if I would just take 10 minutes in the morning
Uh-huh.
and do it, yeah, it really made a difference. So,
Yeah,
yeah.
that's good to hear. Any other questions or comments? All right.